We are joined now by Dr. Celine Gounder, who is on President-elect Joe Biden's COVID-19 advisory board. She's an infectious disease specialist and epidemiologist at the NYU Grossman School of Medicine and Bellevue Hospital. Good morning, doctor. Thanks for being with us. We've recorded more than 100,000 cases now for 8 straight days. What do we need to do to get control of this?
What we need to do is what scientists and public health experts have been saying from the beginning of the pandemic, which is that we need to be masking, social distancing, remaining 6 feet apart. Now that we're indoors more, we need to be keeping windows and doors open as much as possible. We need to be getting tested frequently. And if somebody reaches out to you, a contact tracer reaches out to you about a potential exposure, please work with them so that we can help identify where the virus is spreading.
Do you see the possibility of a national lockdown coming?
You know, I really don't like the word lockdown. It implies this is an on or off switch, a binary decision, when really what we're talking about is a dimmer switch or a dial. And I think what we need to be tightening up right now is indoor dining, going to bars, indoor gyms, that sort of thing. And we can really keep schools, for example, open much longer if we tighten up the areas where we're most likely to see spread.
We've seen that in New York, Dr. Gounder, which, of course, from the beginning was the epicenter of this virus. There are new restrictions now as the cases rise here, including a limit of 10 people at indoor private gatherings. Is that enough?
I really think we probably need to step back in terms of indoor gatherings to our household bubbles. So that's the people you live with, whether or not their family might be your roommates. But as was pointed out in an earlier segment, college students who don't live in the household really are not part of that household bubble. And things like parties, other private gatherings are something that we really need to be putting a pause on right now.
What about restaurants?
You know, in New York City, we have reopened indoor dining to some degree at a reduced capacity. We have outdoor dining. I think indoor dining is another one that we know is a major spreader of the infection. When we've seen indoor dining reopen in other parts of the world, other parts of the country, it has certainly correlated with an increase in transmission in the community. And so I think what we need to do is figure out creative ways to do more outdoor dining and put a pause on indoor dining as well.
And what about masks? Are we getting the cooperation we need? Do we need a national mask mandate? Is that even a possibility in your view?
Well, I think, unfortunately, masks have been politicized. It would be like politicizing the use of toilet paper. This is a very basic, hygienic, public health measure that we need, all of us need to be taking personal responsibility for ourselves, for our health, for the health of our family, the health of our community, and we need to mask up. That is something that is in our power to do right now and can make a tremendous difference in curbing the spread of the disease.
We've also got a surge in hospitalizations right now. I think the number is nearly 62,000 people in this country be hospitalized because of the coronavirus. How will the advisory boards help hospitals get the supplies and the resources that they need?
Well, I think the president-elect is looking at invoking the Defense Production Act as one of his first actions once he takes office. And that really would allow us to put pressure on manufacturers to mandate that they be producing the personal protective equipment that we're already running short of in many hospital systems right now.
Dr. Gounder, as we've noted in the last week, Pfizer has announced a vaccine that they intend to submit for an FDA emergency use authorization in the coming weeks. Is there a plan to get that vaccine out as quickly as possible?
Yes, and I think it's important to understand that it's not just the advisory board that I sit on that is providing support to President-elect Biden and Vice President-elect Kamala Harris. It's also a very deep bench of scientists and public health experts and others who are on the transition team, as well as others. And these are plans that have been in the works for a while. Some of these conversations are happening with the private sector, big players like CBS and Walgreens. trains, for example, are really going to be key in terms of the distribution of the vaccine to communities throughout the United States. But the plan is to be ready on day one to move forward with distribution of the vaccine.
All right, that's encouraging. Dr. Celine Gounder, thank you very much.